1980s, a new class of drugs called SSRIs were released on the market. They were seen as a wonder pill that corrected the chemical imbalance in the brains of the depressed. Recently, this long-held theory of depression being caused by a chemical imbalance has lost support among psychologists, as it lacks significant evidence. What more, SSRIs are still being prescribed to treat a cause of depression that doesn't exist, and in some cases does more harm than good.
It is evident by the way that we see these drugs being used in everyday clinical practice that it is the pleasurable effect that medications provide, which users chase and continue to medicate themselves for, allowing them to avoid the root problem in their psychological diagnosis. By stimulating their brains with dopamine and serotonin, individuals experience feelings of short-term relief, chemically induced happiness that is unnatural, and changes the structure of the brain permanently to depend on these psychoactive chemicals to achieve a feeling of normality. This approach only temporarily reduces symptoms of depression, medicating individuals into thinking they feel good while discouraging them from addressing the main cause of their symptom. The long-term implications of using medication are severe. In a study conducted by PubMed Central that collected data from 180 patients using antidepressants from anywhere between 3 and 15 years using an anonymous survey, they concluded that common adverse side effects included withdrawal, with 73% reporting, sexual problems, 72%, and weight gain, 65%. As well as this, they reported users feeling emotionally numb at a staggering 65%, and those experiencing signs of addiction at 43%. As you will see, the associated risks with using antidepressants and antipsychotic medications span far greater than most of us realize, specifically the increased rate of morbidity.
In the year 2005, the FDA came out with their first warning that antipsychotic drugs were increasing the risk of morbidity and mortality in the elderly. That elderly folks exposed to antipsychotic drugs had a higher risk of heart attacks and strokes, of swallowing difficulties leading to aspiration pneumonia and death. And as I was reading this, it immediately put me in this ethical dilemma. How can I continue to prescribe these medications in the same way, knowing what I know now?
So I guess that's where this story ends. The most widely established and commonly used form of treatment for mental ailments is medication, and I suppose there's no changing that fact. But what if I were to claim that an external source of treatment that targets the same brain mechanisms responsible for emotional well-being and reduced stress can be achieved through non-invasive and holistic measures? That is where I introduce an alternative protocol to drug intervention: music therapy. What is music therapy? Essentially, it is a musical intervention that the Cleveland Clinic defines as singing along to, playing, or listening to music with a licensed therapist. It can appear in a few several core methods, including compositional and receptive. In compositional music therapy, patients are instructed with creating their own music, while in receptive, patients listen along to music with their licensed therapist. In a diagram presented by the Cochrane Library that measured the associated risks between psychotherapy in conjunction with medication versus music therapy after 3 months of treatment, they found that music therapy was linked to significantly lower clinician and self-reported depressive symptoms. Meanwhile, the quality of life reported by those who practiced music therapy reported significant improvements as opposed to those who used the standard treatment method of intervention. Moreover, 35 out of 1,000 patients left the study in the cognitive behavioral therapy control group, whereas only 9 out of 1,000 individuals discontinued their music therapy treatments. In a study conducted by researchers Stefan Kolsch and Joke Bratt, they found that the neural mechanisms underlying this sense of pain in the brain can be alleviated through practicing music therapy, as there's a very similar overlap between the brain networks for pain processing and for reward and pleasure. In this sort of neurochemical perspective, they specify that the endogenous opioids and dopamine play an important role in creating a sense of this music-induced analgesia. Essentially, analgesia is the inability to feel pain, and they argue that there is a noticeable reduction of pain perception that occurs when an individual listens to music. The researchers also touch upon the topic of sensorometer synchronization, which we have seen in the previous clip of music therapy being performed in real time. It can be described as tapping, breathing, or moving in synchrony with music, which the researchers claim not only amplifies the pain-reducing effects of chronic symptoms, but also offers promising therapeutic potential for mental health conditions that extend beyond depression. Essentially, aligning a type of motor activity with a sensory stimulus reduces the debilitating symptoms that mental health disorders can have on an individual. Ultimately, music therapy is a low-risk and underrepresented breakthrough, with the potential to influence modern-day medical practice significantly. If we ignore the prominence and therapeutic achievements of this therapy, then we are stuck in a world that prescribes medications to individuals as a default solution, rather than addressing their emotional and psychological needs through proven and non-invasive methods. If we continue to embrace ignorance over research, we will limit the scope of the medical field and discourage alternative treatments for a beneficial future.